Now, as you already get the idea of what is conjunctivitis, let's move on to the second eye infection. Let me give you another scenario for you to imagine. You wake up in the morning, suddenly you feel something on your eyelid that makes you uncomfortable. So you open your phone camera to check it out, and turns out it is a lump that kinda look like a pimple. You are now tempted to pop it. Nope, you should never try to pop it under any circumstances, as it could be a stye and popping it might worsen the infection. So what stye actually is? Stye, or medically known as hordeolum, is a red, painful lump near the edge of the eyelid that may look like a boil or a pimple and often filled with pus. It usually forms on the outside of the eyelid, but sometimes it can also form on the inner part of the eyelid. How to be sure that it is a stye? You should look out for these symptoms. If you have a sore and scratchy eye, red lump on eyelid like a pimple, swelling and pain of eyelid, and crusting of eyelids or lashes, yes, my friend, there is a possibility that you have a stye. Let's look at the possible causes of the stye. A stye is caused by an infection of oil glands in the eyelid. Staphylococcus species of bacteria is commonly responsible for most of these infections. The risk factors include touching your eyes with unwashed hands, inserting contact lenses without thoroughly disinfecting them first, using expired makeup, and certain skin conditions like rosacea. How it is usually treated? Since it's a bacterial infection, the best way to treat this infection is with an antibiotic. The doctor may prescribe you with oral antibiotic such as amoxicillin and tetracycline to help you recover faster. In some cases, like external stye that has ruptured, a topical antibiotic like erythromycin may be prescribed. It can also be treated by applying warm soaks 4 times a day for 15 minutes. The most important question, how to prevent this stye? Firstly, wash your hands with soap and warm water, or use an alcohol-based hand sanitizer several times a day. Keep your hands away from your eyes. Next, reduce your risk of recurrent eye infections by throwing away old cosmetics. Lastly, if you wear contact lenses, make sure your contact lenses are clean and make sure you wash your hands thoroughly before handling your contacts.